It's normal to go home completely exhausted physically and emotionally, not just because of your heart condition, but also because with everything that goes on at night at the hospital, it's hard to get a good night's sleep. Besides, maybe this time last week you didn't even know you had a heart issue, and the emotional impact of that sudden change has a corresponding physical impact. Don't overdo it when you first get home. Friends and family are important social supports, but you may want to limit visitors for the first few days. Listen to your body. Make sure you get the rest you need. Ask a family member or caregiver to help you by getting groceries or running other errands. The danger signals to watch for are set out in your patient guide and on the stoplight chart. Keep them handy for quick reference. You may feel anxious for many reasons. If the heart issue caught you by surprise, you could be feeling especially vulnerable. Or perhaps you're uncomfortable being far from the professional healthcare staff at the Heart Institute. As you return to normal sleep and build your strength, these completely normal feelings will ease. It's normal that you'll be very tired in the first couple of weeks. You've had a heart attack, been in the hospital, and may be adapting to new medications. Let your family or caregivers help you. Make a grocery list, ask them to do house cleaning, and so on. This will go a long way to allowing you to focus on your recovery. The more you focus on recovery, the more quickly it will happen. Make an appointment to see your family doctor within 2 weeks after discharge, or for the first available appointment. Make sure you know which cardiologist you are following up with and when you should see them. Ensure you obtain the office card with contact number. If you don't hear from anyone within a few weeks, contact the cardiologist's office. If you didn't meet with the cardiac rehabilitation nurse before your discharge, call her or him now. 2 days after your discharge, you will receive a follow-up call from our telehealth system. We will be checking in to confirm you have filled your prescription and are taking your medications, and have booked your follow-up appointment with your doctor. If you can't answer or don't want to answer the automated system, we will call you in person. You will also receive automated calls 1 month and 3, 6, 9, and 12 months after going home. Depending on your responses, you may also receive a phone call from one of our nurses. Your patient guide contains specific nutrition suggestions and details of your walking program for your return home. During your first week home, you can start your walking program, which is described in your patient guide and in the Heart Healthy Living module of this video series. Walk your dog, if it is small and well-trained. A dog that unexpectedly lunges after something could hurt your healing body. Write, draw, paint, read, watch TV, or even use a computer. Knit, do needlework, meditate, do stretching exercises, climb stairs slowly, as necessary, not for fitness training, go on short outings, lift no more than 5 to 10 pounds when necessary, not for fitness training, be active. Do a little more each week until you're back to your pre-heart event activity level. Until you've completed a cardiac rehabilitation program, you won't be ready for demanding activities such as running a marathon, playing recreational or competitive hockey, or weight training. Don't drink alcohol if your doctor has advised you not to. Otherwise, use the following guidelines. Men, limit to 3 drinks a day, max 15 per week. Women, limit to 2 drinks a day, max 10 per week. Check your patient guide for recommendations about increasing your activities of daily living. You will gradually be doing more as your strength and stamina increase. For your walking program, gradually increasing the length and intensity of your walks as set out in your patient guide. You may want to review this section in the patient guide with your partner. Generally, you can resume sexual activity about 4 weeks after a heart attack. If you are using medicine for erectile dysfunction, you need to check with your cardiologist when you can resume this medication, typically in 6 weeks. While most patients and partners recover emotionally very well from a cardiac event, some may experience anxiety and depression during their recovery. We like to think we are invincible, and suddenly we are not. We lose our independence for a short time. We may not be able to return to some activities. Common signs of mental health issues include severe mood swings, difficulty sleeping, feeling overwhelmed, depression, anxiety, or crying for no reason. If symptoms persist, talk with your family doctor about supports available to you. The Heart Institute can support you through cardiac rehabilitation with resources including counseling with a social worker focusing on adjusting to changes after a heart attack, assessment and treatment recommendations from the psychologist focusing on changes to mood, worries, and behavior, programs to help you manage factors linked to heart disease, for example, managing stress and anxiety, or work counseling. All of the above resources are covered by provincial health insurance, OHIP. For some of these programs, your spouse is invited to participate given the impact your condition can have on your relationship. If you have a mostly sedentary job, working at a computer or desk for example, you may be back to work in 4 weeks or less. If your job has strenuous physical requirements or heavy lifting, you'll likely return to work in 6 to 8 weeks. You and your cardiologist will agree on a date for your return to work. If you need a form or letter for your employer, please ensure you have a family member or friend bring it in for your doctor to review and sign before you're discharged. This module has summarized what to expect in the first 2 weeks after your heart attack. The next module focuses on the important role of medication in helping you manage your heart condition.